special guest with us today, Marilyn Bautista, is an NHS nurse in the United Kingdom. Now, she sets up COVID-19 wards, but she also contracted the virus herself. Hello, Marilyn. Welcome to the program.
Hello, Alma.
How are you doing?
I'm okay.
You're okay now?
I'm doing very well at the moment. Thank you.
Okay, so Marilyn, tell us, thank you for accepting this interview. Can you tell us more about yourself and your role in the NHS?
I'm Marilyn Bautista, as you have said, and I have been a nurse here in the UK for 19 years now. But I have been in this profession for 24 years since I graduated in college in the Philippines. I have been working in the same trust in the NHS since I first arrived here in the UK. And I have been blessed to get the post as a clinical ward sister for 3 years in the endocrine ward.
And so you've been taking care of coronavirus patients as well.
Yes.
So how do you feel about that? Weren't you scared?
Well, when I first found out of the first cases we have in our hospital back in early March this year, I'm really not that worried at first because as nurses, we regularly deal with different kinds of infectious and contagious diseases in the ward. Because nurses, we are trained for the proper protocol for infection control, although policies for this varies in every trust. However, the reality of how fast this deadly disease spread sunk in when our hospital management have decided to convert all the wards in our block, except for one, to be a COVID ward.
Okay.
That's the time I realized this is getting really serious now.
And you got COVID. You were infected, right?
Yes, Alma. I was at work when I first present some COVID symptoms. Temperature of 38 degrees Celsius and a dry tickling cough. And I had to be sent home by my manager. And I was advised by the sickness monitoring team in our trust to self-isolate at home. I have a 9-year-old daughter, and my husband also works in the administration and procurement at the same trust. We live in together. They are the ones that I am most concerned of on passing the disease to if I contracted the virus. A couple of days since I have presented the symptoms, I managed to get tested for COVID with the help of my husband's manager in the ED. We had to park outside the ED and had my swabs done in the car. And unfortunately, the swabs came back positive. I continued to self-isolate from my family and just stayed in my room all the time, except for bathroom privileges. And since I tested positive, my husband had to sleep in the living room for the time being. And my husband needed to be off from work too for 14 days. I appreciate the care and the support he provided as I am unable to do my mommy duties at the time. But I thank the Almighty God that even if I contracted the virus, I only had mild symptoms and did not affect me as most of other people in my profession did. All the symptoms have gone after 7 days since I first presented them. But on the safe side, I continue to self-isolate from my family for further 7 days. I am now fully recovered and no symptoms since. My husband has come back to work and my daughter has been in good health.
What were your symptoms? I just want to know, what did you feel first?
So at first, I had, for a couple of days, I had temperature, high temperature. It didn't go higher than 38 degrees Celsius. After a few days, I felt some dizziness, dizzy spells, and yeah, those are my symptoms. I didn't get much of breathing problems, maybe because I normally take an inhaler for my asthma, and
Oh, you have
I
asthma
believe
as
that helped
well.
me.
Uh-huh.
Yes.
So how did you decide to have the test because of those symptoms, and you got a positive test and you got a positive result for the COVID? Did you have it in the hospital where you work in?
Yes. So I've mentioned, we had to ask favor from my husband's manager in A&E, or emergency department, and they took a swab from me in the car park, because I can't be inside the emergency department.
That's kind of difficult, yeah. Were you given any support or financial support or aid from the government?
In terms of financial support, the only support I believe is that since I work in the NHS, they are very supportive in terms of, like, they didn't mind that I'm recuperating for the illness, and since I have a medical pre-existing condition, I had to still be off work from at the moment, and I believe that's a big support that they have given me so far.
Okay, so you've fully recovered, and that's very good news. Do you have any advice for our viewers and our public, or for the public, for coping at home?
Yes, if we are coping with the virus at the moment, you still try to think positive in our outlook in life. Talking or FaceTiming with friends and relatives help me to go through every day. We may feel discouraged at times and would worry, but the thing that helped me the most was a sincere and humble prayer to the Almighty God. Boredom could also strike us during this lockdown period, but there are plenty of ways to fight it. You can do your favorite hobby that you can do indoors, or maybe at your own garden if you have one, and cooking or baking perhaps, and assisting your kids with their home learning. There are plenty of ways. I believe this pandemic has taught us something, that in times of this crisis, the integral part of the community, which is the family support system, is at its best. And above all, I learned how to trust more in our Almighty God.
All right. Thank you so much for that. Thank you for sharing your experience with us. Thank you. Thanks to you, we might come out more patient and understanding in relating to such crisis such as this. Thank you so much for your time, Marilyn. Thank you.
Thank you, Alma.